Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we're announcing 2 additional deaths due to COVID-19, both from the Winnipeg Health Region. I'd like to extend my condolences to their family, their friends, their loved ones. Our current 5-day test positivity rate is 5.4% provincially, 4.4% in Winnipeg. As of 9:30 a.m., 97 new cases have been identified, bringing our total to 31,483. While COVID-19 variants are expected, we'll continue to see new variants. Some are significant, what we call variants of concern. They may be more severe, they may spread easier. And in the longer term, that community spread of variants will result in an increase in case numbers, again leading to that strain in our healthcare system. So we've already identified 4 cases of the B117 variant that was first identified in the United Kingdom. We do not have any additions to that at this point. But our goal is to slow the introduction of the variants of concern into Manitoba, while at the same time increasing our vaccine rollout as the supplies permit. We've introduced those travel restrictions and self-isolation requirements in order to delay that introduction of these variants of concern. We know that the virus can also be transmitted by people who do not show symptoms, or at least are showing very mild symptoms. And certainly concerning when if people would have a number of contacts, even contacts within their household. And so as we are doing our cautious reopening very slowly, which means we're decreasing public health measures in one side of things, then we need to increase our public health measures in other aspects. And that's why aggressive case and contact management will become more and more important as we slowly reopen Manitoba. And so these changes are to help address the diminished public health restrictions and also protect against community transmission of the variants of concern. So some of these increased or more aggressive case and contact management include lowering the threshold of prolonged contact from 15 minutes to 10 minutes. And again, this is a guide. If there's high risk contacts where we feel somebody was, absolutely exposed to droplets, then that could be, as little as just a few seconds or minutes if we felt on the history. But for the most part, our guide is we're going to drop it from 15 minutes to 10 minutes. By that way, we'll have more people identified as close contacts, so more people being required to self-isolate. If someone in a household tests positive for COVID-19, all household members will be considered close contacts. In the past, we allowed, in certain circumstances, positive cases to self-isolate within the home if they had certain precautions in place. We've changed that in the past for the variants of concern. We're going to change that now for all positive cases. So everyone within a household with a positive case is going to be deemed a close contact. And, so public health will advise each of these contacts on how long they're required to self-isolate. If somebody of a close contact of a case lives in a different household, all members of that close contact's household must also isolate until the close contact has been tested and they have a negative result. So again, expanding the amount of people who will be able to or required to self-isolate. So any close contacts without symptoms will be advised to get it tested at day 10 after last exposure, just to identify early cases. And close contacts with symptoms will be tested as symptoms develop. Close contacts will be required to self-isolate for a minimum of 14 days, and that's regardless of testing results. That's because the incubation period of this virus is up to 14 days. And so we're working on our web content to update those materials. So to continue moving forward with our cautious approach, our slow reopening, we need to prevent the introduction and the widespread transmission of the variants of concern. We need to ensure we're aggressively managing cases and contacts that we do identify to ensure that as we are loosening our restrictions, which means there's going to be more and more interaction, we need to do whatever we can that interaction isn't involving cases. And so the fundamentals will apply for the foreseeable future. Stay home when you're ill, even mildly ill. This is very vital to our reopening. We can't have people out in public with even mild symptoms. We're going to see those large amount of contacts. You heard of that example a couple of weeks ago of someone, again, not noticing the mild symptoms and resulting in 60 plus contacts. Our reopening will not be successful if we have many cases like that. So stay home when you're ill, get tested early, get tested with very mild symptoms, self-isolate as directed, wash your hands, wear a mask, cover any coughs or sneezes. If someone in your household is waiting for test results, your entire household needs to self-isolate, and that certainly includes if you're waiting for a test result. So again, we've had those examples of somebody that was concerned enough about the symptoms to go get tested, yet had visitors over at the house while waiting results. The result came back positive, and so those are really unnecessary contacts. That person we would want to be self-isolating and reducing the amount of contacts they have pending that result. And again, these are not intuitive things. These are things that we need to keep reminding ourselves of. It's not about focusing on that individual. It's just these are the examples that will lead us back into November and December. And there's a lot of things we can do right now as we reopen things to protect against widespread transmission of this virus. So we're going to continue to focus on those fundamentals. We're going to stay home, as much as possible when we're out. Make sure we're aware of those fundamentals. We're encouraging Manitobans to be very safe, but I do want to also encourage Manitobans to consider donating blood. It's still very essential, and donations are always needed. Obviously, the need for blood does not diminish during a pandemic. So please consider booking an appointment through the Canadian Blood Services to donate blood and save lives. So thanks again. I'm happy to take some questions.
Thank you, Doctor. A reminder to our reporters on the line. You will have one preliminary and one follow-up question. That's one follow-up question. And up first this afternoon from Global News, Amber.
Hi. So I'm listening to you kind of talk about your new kind of contact tracing. Do we have enough contact tracers and the infrastructure to handle this sort of more rigorous approach?
Yes, yeah. So what we've done is increased our capacity for contact tracing to be able to do the contact tracing and contact management and follow-up for many times the cases that we're seeing right now. So we've been preparing for that. So right now we certainly are at a very good spot, but we've put things in place to be able to ramp up quite quickly if we see even multiple times the cases we're seeing right now.
Okay, and I'm sure you know the travel restrictions are coming into place here in Canada. Are we going to be considering something, in the U.S. they're doing a lot more vaccines than we are here. Are you guys considering a different tiered approach that maybe the restrictions would be different for somebody who's coming in who already has a vaccine?
So I think it's really early for that. And again, the international travel restrictions are going to be dealt with through our federal counterparts. So I think it's early to have that type of approach. I think at some point it's going to be a real possibility that vaccine passports are going to be a real thing, but right now it's not in the works.
From the Brandon Sun, Michelle.
Good afternoon, Dr. Roussin. So with an outbreak declared at Valley View, but only one case so far in a staff member, are we seeing vaccines have an impact on transmission rates and test positivity rates in personal care homes at this point?
So it's early to tell. Certainly, looking at our numbers, we're seeing a diminishing amount of outbreaks, diminishing number of cases in that regard, and it's what we expect. We would expect to see a lower amount of cases, lower transmission on there. So right now we're still focused on protecting the most vulnerable Manitobans, and so we're very aggressive with whenever we see even a single case within a facility like that. Over time, as we have second doses administered, our threshold for declaring an outbreak may change, but right now we're continuing to be very aggressive.
Okay. And I'm wondering, just as an overview regarding personal care homes, what are you seeing? Are you seeing good things there?
Well, we saw very good uptake of vaccine in staff and residents. And so we've seen over time the diminishing amount of cases seen within these facilities. And so we're going to continue to have all the precautions in place. The vaccine is just yet another tool. It's not going to replace the screening, the fundamentals. But overall, just like what we're seeing, overall with our numbers, we're seeing a good trend.
From CJOB, Will.
Good afternoon, Doctor. Wondering if you can comment on the record-setting deliveries of Pfizer vaccine Canada and by extension Manitoba is expecting in the coming weeks. Maybe without getting into logistics, could you just give us a sense what this means for us and how long before we start to see an effect on our society as a whole?
So, I think our rate limiting step up to now for vaccine had been just the amount of doses we receive. So the Vaccine Task Force has the ability to ramp up, get vaccines into Manitobans' arms, as quick as we receive them. And so I think it's obviously good news that we're seeing more and more doses, and we'll be able to get that into Manitobans' arms. Early on in this vaccine campaign where we had such scarce numbers, things like population level effects like herd immunity just couldn't be the goal. We just didn't have anywhere near the amount of vaccines to achieve that. As we receive more and more, we're going to start approaching those levels, but we're still many months away from that. But even before that, we're protecting some of the most vulnerable Manitobans. And so the goal with that is to start seeing less and less severe outcomes, meaning deaths and hospital admissions. So the more vaccine we get, the quicker we're going to be able to protect those vulnerable Manitobans.
Okay, thank you. And do you have any estimates on how many more close contacts may be identified in the new methods you're announcing today? Would it be like 25%, 50%, not quite that much maybe?
Yeah, it's kind of difficult to know. We're expecting that we're lowering that threshold, so we fully expect to find more contacts and have more people self-isolating. But to quantify that's really difficult.
From the Winnipeg Sun, Glenn.
Yes, Glenn Dawkins from the Winnipeg Sun. I just wanted to clarify something. So for those additional measures, it's for anyone who's tested positive or just people positive for the variants of concern?
Right, yeah, thanks for that. So this is going to be our overall case and contact investigation. And so there's, the variants of concern are certainly one reason for this. But the other reason is, like I was saying, is we're reducing public health measures on one side of things, and that's the public health restrictions. So we need to be able to get more aggressive on another side, or we're just going to see those case numbers climb again.
On Saturday, on a other subject, on Saturday there was a rally at the Human Rights Museum calling for the lifting of the lockdowns due to mental health concerns of Manitobans who may be, shut up and had mental health concerns before this, and obviously COVID and the restrictions have not helped. Can you respond to what those people were asking for in terms of, do you see the lockdowns perhaps being eased off soon?
Well, I think that this pandemic's been difficult on Manitobans. People around the world has been difficult on. And I think the restrictions, certainly have an effect on both good and negative effects. That we're always finding that balance. So we were in a place in December where our hospital capacity was in jeopardy. And if we start turning people away from ICU beds, this is not a place where any of us could be. We saw the restrictions absolutely worked. If we look at where we were in November and December and to where we are now, this is the restrictions. This is decreasing the amount of interactions that Manitobans have. We had very little choice but to have these restrictions in because our hospital, our healthcare systems were overrun. So now seeing these numbers trending in the right direction, we are cautiously starting to reopen, but it's not going to be just a sudden return to normal. We're not anywhere near population level protection through vaccines. And this virus is still here, and we have the variants on the front. So if we simply go back to where we were in October, then we're going to see November and December again.
From CBC Radio Canada, Matthew.
Hi, Dr. Roussin. Pfizer announced that its vaccine can finally be stored at the higher temperature. I want to know if it's changing something for Manitoba or not.
So the vaccine task force will be, looking at this. I think that the logistics of these first vaccines were quite challenging. Storing it, the Pfizer -80, Moderna -20, and so the mobility was quite limited. A lot of logistical issues with this. Anything that eases that burden is going to be good for any vaccine program. And so on the specifics of that, we'll have the vaccine task force comment.
Thank you. I don't have follow-up question.
From CBC Manitoba, Bart.
Hey, Dr. Roussin, speaking of more aggressive measures, why doesn't the province do more than just education at our land borders, Saskatchewan and Alberta, and for visiting, or rather arriving, domestic airline passengers at Richardson?
Well, I think it's been something we've looked at in the past. We had some of these restrictions on in the first wave, and still now. I think it's really important to do what we can to delay the introduction of these variants of concerns, knowing that we're going to see these variants of concerns. We're going to see new variants of concerns develop over time. That's just the nature of these type of viruses. So we do look at those things. I think there's a lot of inherent challenges with the interprovincial travel and dealing with it, but things that we continue to look at over time, and and we'll try to increase our measures in that regard. But there isn't a specific plan. It's quite challenging.
All right then. Amber asked you about contact tracing resources. We had hundreds of bodies, full-time equivalents, devoted to that in November and December, when we were in that really high spike of the November-December fall wave. You said we have the capacity to do many, many times more, but can you quantify that a bit? I know you and your colleagues were able to in the past. Where is our complement now, both in terms of people on the job and standing by to be added to the job?
Yeah, so I don't have the exact numbers of people standing by, but what we've done is we've changed our processes and our approach to the contact tracing and the follow-up. And so, our goal is to be able to, do multiple times what we've seen, even, more cases than what we saw in November and December on single days, to be able to reach, very significant proportions of those people within the 24-hour period. And so exact numbers I don't have, but we set up a goal to be even more responsive to than the numbers that we are seeing in November and December.
From the Canadian Press, Steve.
Oh, hi, Dr. Roussin. I'm wondering, are we going to get some more forward-looking projections? We've had some in the past, and recently with the introduction of variants, we've seen other jurisdictions such as Ontario release some projections. Again, these are always sort of ballpark numbers with a lot of assumptions and variables in, but are we going to see that here in Manitoba?
I think we've been, wanting to be able to share more modeling examples with Manitobans, and so I don't have a specific date that's set out on that. And the models are, predictable on what we'd see. So we have our, sort of our 4 scenarios. Where we're in a best case scenario, say, where we have very, very strict public health measures with great adherence, to say number 4, where we have very little public health restrictions with very little adherence. Right now we're essentially at that second to best area, where in November, December, we were in the worst case scenario. And so if we stayed on these lines, we'll continue to see a downward trend. As we loosen things, as we get less and less adherence, then we start slipping into the other scenarios. And then you add on that the variant, sort of shifts us to the, shifts us to higher case counts within each of the public health restriction levels. And so I don't have a specific date, but we can look to try to share those specifics, but they're predictable. We've seen them all, and they're going to show the same thing. As we loosen restrictions, if we don't have great adherence, we're going to see case numbers go up, and they're going to go up quicker if we have that variant of concern here.
And in recent weeks, have you noticed any trends in terms of the source of transmission? Are there more it was a high number of household contacts, close contacts, mainly in the household. In recent weeks, have we seen any shift in that? Is there more or less community transmission versus close contacts?
Yeah, so, barring, excluding some of the outbreaks that we've seen in isolated communities, we're seeing less community-based transmission, so more known contacts, and many of these being household contacts. So our case numbers have, for the most part, plateaued. We see some early indicators of possible slowly climbing numbers, which we expect as we loosen restrictions. But it's just another reason why we're going to get more aggressive with our case and contact management.
From CTV Winnipeg, Michelle.
Hi, Dr. Roussin. Looking for clarification about music schools and music lessons allowed to offer in-person lessons under the current public health orders. So what is allowed here? Can people go to a business and do it, but not go to a home and do lessons? Can you just explain that, please?
Yeah, and so this we get into these spots with every iteration of the order because it's very difficult to write orders for every possible scenario, and so with this last iteration of the orders, we had looked at sort of the gyms and fitness facilities at the 25% capacity, catering to individual fitness or one-on-one training. We were actually able to broaden that to include other type of things like lessons at that 25% capacity. We wanted to keep it one-on-one just to ensure that all the measures would be taken by everyone. The in-house, we didn't really contemplate that. So people who in any of the orders, people who run a business normally out of their house, and their business was allowed to be open, then they could still function in that way. In these orders, it's really traveling to other people's house. So I don't think we contemplated that with this. So for now, it's the business is at 25% capacity. It's one-on-one right now. And, just as we see that these next orders are set to expire, and we're looking further on what we can do next.
Great, thanks. A further question to the new contact tracing and contact management measures. What if somebody in the house is a healthcare worker, like someone working in a hospital? Are they exempt, and are there any professions or any circumstances that would exempt somebody from those?
Yeah, and so as far as if we have a case or a contact there, then it's going to be up to at the individual level, and so we've always had our occupational health and safety involved in these type of things related to healthcare workers. Obviously, there's a lot of demands on our healthcare system, so we don't want to cause more issues by having people self-isolate when it's not all possible. Plus, they have the ability to closely monitor symptoms and wear PPE effectively. So on those individual circumstances, there may be times where somebody who is would normally be able to or wanting to be self-isolating may be able to return to the workplace, but it'll be a case-by-case basis.
From City News, Jonas.
Good afternoon, Dr. Roussin. First question is similar to what Michelle asked previously, but this one is regarding dance studios versus gym or yoga studios. I guess they're still closed. Is there any, message you could give those folks that are still, battling with these public health orders and being excluded?
Yeah, well, we want to, do things as safe as possible, but balanced. We know that there's a lot of good that occurs with the work that these places do, and certainly that's recognized. But we know that we don't want to go backwards. If we open things up quite quickly, there's no reason to think we don't get November and December again. And so these next iteration of orders are, being deliberated now. We see our case numbers in the right direction. And so, I'm not going to speculate right now on what exactly things will look like, but we hope to have a continued reopening moving forward.
Thank you very much for that, sir. And just as a follow-up, we're hoping to step up contact tracing, be more aggressive. But when it comes to control in COVID-19, do we have any, I guess the question I'm asking is it an illusion of control, or how confident are you we can control this time?
Well, I mean, I think that there's certainly effective measures that we have. We've said even from the first wave that we've never been helpless against this, right? So things looked very concerning in November and December, yet we know exactly what we could do to bring the numbers down, and we did. So we're never helpless. What we want to do is put ourselves in a position where we don't need to have such widespread restrictions to do that. And with that, then we need a lot of buy-in. We need people who have been advised to self-isolate effectively. We need people who were concerned enough to go get tested to wait those test results and not expose other people. So there's a lot of things we can do. So I definitely say if we continue to step up, if we continue to self-isolate as appropriate, then we can continue to loosen things. But if we lose sight of those fundamentals, like we probably did in November and December, those numbers will be waiting for us again.
From CHVN, Taylor.
Hi, good afternoon. Will the completion of the care home vaccines change visitation policies?
Immediately it probably will not make that change. What we want to do is ensure that we get the vaccines in people's arms. We're going to focus on getting widespread vaccines done at the population level. We still have very vulnerable people within those settings, We know that vaccine uptake is not 100%. It's been very good. It's not 100%. And we know that vaccine effectiveness, like any vaccine, isn't 100%. So we want to still do what we can to protect the most vulnerable, but things like visitation guidelines over time we'll be able to change those, but it's not something that we're going to just immediately tie to vaccination.
And how are those co-visitation pods going? Have you been hearing of any success stories, or are any hiccups on your radar?
You know, I haven't heard any specifics. I think that they offer that opportunity to safely visit some of our most vulnerable Manitobans, and you know, I think that they're being taken advantage of.
From the Winnipeg Free Press, Danielle.
Hi, Dr. Roussin. Going back to the variants of concern that were announced on Friday, how did a person have more than 20 close contacts if they self-isolated? And are you concerned that quarantine enforcement is not as strict as it needs to be?
Yeah, so I won't speak, you know, specifics about an individual, but yeah, I mean, you know, it's definitely not the goal of the Quarantine Act measures. It's not a goal of our travel restrictions to have someone have that 20 contacts. And so, you know, moving forward, this is what we're trying to say is that we need to rely on Manitobans. We need to understand that this is really important. And when you're advised to self-isolate, if you don't have any contacts and you become a case, that transmission chain is ended. You know, you've unfortunately developed COVID. Most are going to recover. But if you don't have any other contacts, we've just ended that transmission chain. When you have 20 contacts, very, very likely there's going to be many cases linked to that, and especially if it's a variant of concern. So all these measures are in place. We need to follow the fundamentals 100% of the time, because just one lapse like this could bring many, many people with that variant of concern.
Thanks. And I hope you can maybe provide an explanation for some of the genetic sequencing processes related to the most recent cases. So assuming the province learned about these variant cases on Thursday or Friday, and knowing that the travelers had already recovered and completed their self-isolation, why was there a 2 to 3 week delay in reporting out those variant cases?
Well, we were reporting the sequencing numbers, so that when we have them confirmed by sequencing, so that's all improving over time the turnaround on that. So we are now screening all of our test positive, all our eligible test positives. Not all positives have enough genetic material in them to screen, but for the most part, all of our test positives are being screened for variants of concern. Then those plus other random and other targeted samples are being sent for sequencing. So we are only going to be reporting when we have this sequencing back. And so there was, some delays earlier on. Now we're finding that those test turnaround times have improved quite a bit.
And this concludes today's media briefing. Thank you.
Thanks.